Simple as that, right, Dick? There we go. Okay, I'm getting better at this. Oh God, it's don't go forward. What's it? Don't stop. So, yep. So I just want to talk to you a little bit about the credit union. So the credit union's board has been talking about the real significant need locally for affordable senior housing. A lot of our members own their own homes. They want to sell their homes and move into a nice apartment within town that they can afford, and they can't do that. It's very difficult. So that's where the whole conversation started. And I think it was like 3 years ago. I know we talked to the village a little bit when they were looking at maybe potentially doing housing down on the fireman's field, and that didn't happen. So over the last couple of years, we've been looking for a partner to bring affordable housing to town so that residents don't have to leave. They can actually stay there and stay with their families as they need it. So the project has expanded. We had started looking, and for those of you who don't know, the credit union is a low-income community development credit union. So 85% of our members are lower moderate income. And moderate income is like that ALICE population, which is basically the working poor. And they have very significant challenges with managing their household budgets. So we had done some research. The United Way did a beautiful job with a report they call the ALICE report, which is the asset limited income constrained population, which again is basically the working poor. And they did it for the country, they did it to the state, and you could actually break it down to the county level. So when we looked at the county data, we noticed that there is a significant number of not just seniors, 45% of them are living below this, what they call survival threshold, which is pretty low, but single parents, 65% of those households in Saratoga County are very challenged and living below that threshold. And even the young ones, 25 years old and under, 69% of them are living below that threshold. And just so you know, I've put the information here, what that is. The United Way considers a survival budget just basically basic housing needs, basic food needs, basic transportation. There's no goodies, there's no extras in there, and there's no savings. So those are kind of the figures that they utilized when they looked at those budgets. It was $31,000 for a single adult. It's $34,000 for a single senior. It goes to $52,000 for 2 seniors. And then 2 adults with 2 school-age children, it goes up to $74,000 for this, so they can feed and house and clothe the children. And then the 2 adults with children in daycare goes significantly up to $92,000. So, and this presentation will also be posted so you can see, but this kind of defines their survival budget. And you'll notice when you go through there, there are not any extras in there. It's just basic living needs. One of the biggest challenges that they had though with that is they consider, they look at that survival budget and they take 35% of the household income and they apply it to housing, which is still, anything over that is really cost burdened. When we qualify members for a mortgage, 25% is the number we use because that's a much more manageable figure. So a lot of these households are paying more than 35% of their household income in housing expenses, which means they're sacrificing other things. So they're sacrificing either health insurance, or they're sacrificing internet, or they're sacrificing some food choices and things like that. So the credit union is dedicated to helping those households reduce that housing cost burden. So when we looked at the data for the Corinth Village and the Corinth town, we noticed that a little over half of the renters are paying more than 35% of their household income in rent, which is, are actually paying more than 35% of that. And there's a significant concentration of those people. In the town, there's 20% of the residents that are actually renters, and in the village, it goes up to 38%. So when we looked at like, is there housing available and what's the housing, the vacancy rates are very low. So there isn't any excess housing within the area. And then we also looked at how many people are actually living below the poverty level, which is even lower than the United Way's housing level. And in the town, 11% of the people are living below the poverty level. And in the village, just over 17% are. So there's definitely truly a need that the credit union saw locally for affordable housing. So some of the things that the credit union started doing to help these people, because one of the other things that they highlighted in the ALICE reports is one of the most significant things a household can do is actually buy a home, and that stabilizes the financial future of the family because they start building equity instead of actually paying rent. So in the credit union, we actually have mortgage rates and mortgages available for all credit compositions. We will finance 95% of a home purchase with no PMI insurance. PMI insurance is very expensive, and we actually worked with the regulators to get that out of the picture. We are members of the Federal Home Loan Bank. So we are part of one of the programs we have is the Home Buyer Dream Program, where we will put through the Federal Home Loan Bank $9,500 towards the purchase of a home for a first-time home buyer. We have home buyer education. We have all of our loan officers and even our collection staff are all trained credit counselors to help members build that financial stable base and help them manage their household finances. And then what we're here today to talk about is our dedication to bringing in affordable housing to the areas where our members live. And Corinth is our first project in this. We are actually going to work with RISE to present a grant application to the Federal Home Loan Bank to hopefully pay for a portion of the actual build. And the board has also dedicated to donate the land to the project because of the significant need that they feel locally. The biggest thing that we did though, when we were looking for a partner, is we wanted someone who was not just going to build it and leave. We wanted someone who was going to build the housing project. They were going to staff it. They were going to put people in there. They're going to manage the property, make sure it stayed really nice, make sure it stayed up to code and be there. We also wanted somebody who was very experienced with that. So that they know what they're doing, they come in and they understand the projects and they can manage it, which is exactly what we found in RISE, and we're very excited about it. So Sybil is going to tell you a little bit about the project that we have that we've been working on. So Sybil, I'm going to unshare my screen here. Let me see, stop sharing. I'm getting good at it, Dick, look at that. Okay, Sybil, your turn.
Thanks, Sue. I'm Sybil Newell. I'm the Executive Director of RISE Housing and Support Services, and I'm going to share my screen now. Let's see if I can do this as seamlessly as Sue. I don't know. Let's see. Are we seeing it?
Yep, you're good, Sybil.
Yeah, okay, great. Okay, so RISE Healthy Housing and Support Services is an organization that's been in this community for over 40 years now. And you may have heard of us in the past as Transitional Services Association, or maybe TSA. We recently changed our name, but we've been here for a really long time. And our mission is to help people living with mental health concerns, substance use disorders, and other life challenges to remain safe and healthy in the community through housing and supportive services. And when we say other life challenges, that could be a lot of different things: homelessness, chronic medical issues, poverty, other disabilities. So what we do is we provide affordable housing, residential programs, and connections to health and social services, which allows community leaders to have the means of helping our most vulnerable people. And we ensure that we get people back on their feet who are in need of care and support. How we do it is through a couple of different avenues. One is a continuum of housing options. So we have a range of housing options available. The first one is community residences, which you might know as group homes. And that's 24-hour support. Then we have apartment treatment programs, which are more independent. People live in apartments with roommates sometimes, and they're visited weekly, at least weekly, sometimes more if they need it. And then we have supportive housing, which is monthly visits or less, sometimes between 1 and 3 months, depending on the person's need. And we have the affordable housing for the general community. We also have the largest care management program in Saratoga County. We work with people, individuals and families, to make sure that they have access to medical care, dental care, mental health services, any sort of financial benefits they might need, food stamps, or housing. And currently in this program, we are serving more than just Saratoga County. We're serving 7 surrounding counties. We do all this in accordance with our state and federal regulations from the Department of Health, the Office of Mental Health, Housing and Urban Development, and the Office of Addiction Supports and Services. I just wanted to share this slide with you to give you kind of a glimpse of a couple of our properties in Saratoga, just so you can see that we take great pride in the places that we own, and we really do maintain them and keep them very nicely. The Victorian up in the left-hand corner is one of our group homes. Actually, the top three are all group homes. And walking down the street, you would never know that they're group homes. The bottom left-hand corner is our main office, and that's in the middle of Saratoga Springs. And the bottom right-hand corner is Dominic Hollow. That is going to be a development much like the one we're proposing for Corinth, and we are hoping to break ground on that in the next few months. We have lots of other properties beside this, but this is a couple of the highlights. And here's the proposed project site. As you know, the credit union has about 10 acres here on their property where they have the operations center. And they have very, very graciously agreed to donate about 3 of those acres to us for this project, which is such a humongous gift to us. You have no idea. Nonprofits don't get this kind of thing very often. So thank you so much, Sue. But it's going to be down here on the corner of Pine Street and Pine Alley. And it's going to be an L-shaped building that kind of has its back to the river over here. This is what we propose it's going to look like. These are some renderings of what we think it's going to look like. We wanted to make sure that it's going to blend in nicely with the surroundings, some earth tones, exposed wood, exposed stone, and make sure it's just kind of fits nicely into the community. I get asked a lot about the availability of apartments and what makes you eligible for the apartments. So there are going to be 60 units overall, and it's going to be split in half evenly between supportive housing units, 30 of them, and 30 affordable units. So the affordable units are for the general community, anyone who wants to apply, as long as they're income eligible. And half of those we are designating specifically for seniors. So that's what Sue has asked us for, and we're doing at least half for seniors. Of the 30 supportive housing apartments, those are going to be for individuals who do have mental health concerns. And we're going to try to give priority to people in that group who are on the older end of the spectrum. There's a lot of people in the mental health community that are also aging in their homes and need somewhere to go that's affordable and safe. So we'd really like to give this to them as well. In terms of financial eligibility, all the apartments are going to be for people who make between 30 and 60% of the area median income. And right now that's somewhere between 20 and 40,000 for a single adult. For couples, and as you go up, you add, I think it's about 13% per person as it goes up. But right now it's between 20 and 40,000. So we think this is also going to have a positive economic impact on Corinth. There are going to be 8 new jobs that are coming to town in conjunction with this property. And we don't have staff right now to take these jobs. So we will be hiring new people for this. There'll be 8 full-time staff. There will be a dedicated property manager for the building. There will be some staff for overnights and weekends. We're going to have a full-time driver because we plan to have a shuttle to take people wherever they need to go, to appointments or shopping or recreation. We're thinking maybe back and forth between Saratoga and Corinth, back and forth between Glens Falls and Corinth. As we find out what people need, we'll be able to define that a little bit better. We're also going to have staff who are dedicated to the supportive housing units. So we're going to have a program director, 2 case managers to work with people, and a registered nurse who's going to be on site. And the nurse is going to be it's going to be a great benefit. I think we normally don't get this for our programs. In case someone has, diabetes that needs to get checked, if they're coming out of the hospital for some reason, if they have a wound that needs tending to, making sure people are taking medications, or if they just have any general health related questions. So we think that's going to be great. The building will also bring more money into the community because, as Sue said, the less you're paying on rent, the more you can spend on everything else. And to get people out of that survival budget mode and be able to buy some things or get some services that they want in addition to just getting by. We will also be paying property taxes, And there's a little bit of a misconception that since we're a nonprofit agency that we are not going to be paying property taxes, but that's not true. We are required to pay taxes on real estate. What we like to do and what our funders like us to do is to enter into something called a pilot agreement, which is a payment in lieu of taxes. So basically what it is just an agreement we make with the town or the village that is for a set amount for a certain number of years. So that allows us to know how much we're going to be having to pay in taxes every year rather than it fluctuating up and down. So that's the benefit to us. The benefit to the town and the village is that we agree to pay a little bit more than we would otherwise normally have to pay. And we agree to a 2% increase every year. So you actually get more money from this project than you otherwise would if some other affordable housing were to come in. Okay, here's the fun part. I want to share some facts about the project because I'm getting a lot of questions and I just want to kind of see if I can answer some of these questions up front for you. So what the project is affordable housing, also known as workforce housing. It's not your old school, typical low-income housing projects that you may be picturing. The supportive housing units are for people who need minimal support. They don't need to be seen very often. They're capable of living on their own. They are not coming out of jail or rehab. This is not an alternative to jail or rehab. It's not a program for people with addictions. This is just regular apartments for people who need a little bit of extra support to live in the community. And it's permanent housing, so people can move in and stay as long as they want. It's not transitional, so there won't be people moving in and out constantly. Excuse me. It's going to be built by a local contractor, and we learned recently that we're going to be working with Bonaccio. I think a lot of people recognize that name. They have a great reputation. They build beautiful buildings. So I think that's going to be great for this project. It's not going to be built by an out-of-town developer and then abandoned. And it's going to be operated by us, a nonprofit. It's not a for-profit project. We're not looking to make money off of this. Our goal is to provide housing and support to the community, which there's already an identified need for. In terms of our supported housing experience, for the 30 units that are going to be for folks who have some mental health concerns, we've been doing it for 30 years. We've had supportive housing for 30 years. And we currently have 52 supportive housing apartments in Saratoga County. So of those 52, the average age of our current supportive housing residents is 53 years old. So they're quieter, they're older, they're not throwing wild parties. The average length of stay for our current supportive housing residents is 10 years. So most of them have been in these homes for 10 years or more. 22 of the people in our program have been there for more than 10 years, and 6 people have been there for more than 20 years. Supportive housing is a great program because there's a lot of research showing that once people get into supportive housing with the right supports around them, they stay very stable in the community and they don't need lots of other kinds of interventions. This positive social impact for people in the community who might have mental health concerns, the supportive housing units. Like I said, supportive housing actually reduces costs. It decreases the number of days that people spend in the hospital. It decreases the need for ER visits and decreases the need for police involvement with these folks. Because once someone has a stable roof over their head and they're secure and they have people looking out for them, these sorts of things decrease rapidly. So that is just the basics of what I want to tell you about the project. I can leave this up for a second if you want to grab my contact information. I'm happy to hear from anyone, even after tonight. If you have any further questions, please feel free to reach out to me and I'll definitely get back in touch with you. All right, so I'll stop sharing this now. Okay, I think we're back. I stopped sharing my screen, right, Sue?
Yep, you're good. So
Okay.
Sue just put up the chat. So if anybody has any questions, I mean, they can just type them in there.
Okay, let me see what's in there.
I don't see anything just yet. And if, oh, there you go.
Oh.
Go ahead, Sybil.
Will there be a true public forum for those who are not online? I'm not sure about that. We intended this to be the public forum because, you know, with COVID, it's very difficult to get large groups of people together. But we have been presenting at, you know, the town board meeting, the village meeting, and I believe there will be an opportunity at the next planning board meeting to submit questions ahead of time so we can get those answered for you. Next question is, how many supportive housing do we currently have in Corinth? We currently don't have any supportive housing in Corinth, but we do work with, I think it's 31 families through our care management program in Corinth. So we work with a significant portion of the folks from town.
Any other questions? Oh, there you go, Sybil.
Yeah, will Corinth residents be considered first? So for the supportive housing units, we have the discretion to put anyone in those apartments that we need to, and we always would like to keep people in their community. So if we have people who live in Corinth, we don't want to move them somewhere else if they can move into an apartment in their community. So what will happen is, as the project is getting closer to completion, about 6 months before we're ready to open, we'll start advertising that we're taking applications, and we'll advertise heavily in Corinth. So everyone who lives in town who wants the opportunity to apply can be among the first to apply. Do you have an idea of what the rent will be? Rent will be, it will vary based on the size of the apartment, 1 or 2 bedrooms. I don't have the exact numbers right now, but we need to keep the rents at or below fair market rates. And fair market rates are calculated by, I think, HUD. I'm not exactly sure who calculates them, but it's basically the expected average of rental costs in that area. I have found that fair market rates tend to be actually pretty low. Like the amount that you can pay for fair market rates are lower than what you generally find in the community. So they'll be affordable. Shuttle service is available for all residents or just supported housing. I think they'll be available for everyone. You know, we plan to have a full-time driver, so we'll have regular availability. And as we know more what the need is and where people like to go and when, we can really tailor our services to the need. How long would the pilot be for? So the pilot agreement is generally a 15-year agreement. I think that there's some latitude in that. The lawyers work that out with the town. It's generally 15 years, and at the end of 15 years, we would renew it again for another 15 years if everyone agreed, you know, to the terms at that point. We renegotiate the terms and we re-sign the agreement.
Thank you.
Mm-hmm. Will this need planning board or village board approval? We do need planning board approval. We're going before the planning board again this month. We've already been once. I don't believe that the village board has a vote on this.
No, it's all planning board.
Right. Will it be a WC van? I'm not sure what that is.
Oh, I didn't see that question.
Oh, wheelchair. That's a very good point. I think that makes a lot of sense. We're looking to buy you've seen those pretty little shuttles, you know, like the smaller CDTA kind of buses. So we're looking for something small and nice. And I think it's a really good recommendation that we look for something that will be wheelchair accessible. That's a good idea. Will the positions available be advertised in advance to give Corinth community members a chance to apply for positions? So this would be, I assume, the job positions. Yeah, absolutely. Why not? I think people always have, you know, more buy-in when they're working directly in the community where they live. So I would love to have residents of Corinth work at this facility. How has the town and village board been receiving the proposed project? I think it's actually been, received pretty well. There are some people who have some concerns, and they've been asking a lot of questions to try to get their concerns answered. But I think overall, we have a lot of support from the town and from the village. Once people understand what the project actually is and what it is not, I think we do end up with more support, because there's a lot of misconception out there about what it means when we say mental illness. I think people tend to think about people who are criminals or might be violent or might be addicts. And that's really not the population that's targeted for this disability. It's really for individuals who are really pretty independent, who live in the community for a long time, but just need a little bit of extra support. Let's see. Is nursing services available to all? I would say yes. I think that there will be plenty of availability for RRN in the building to be helping out anyone who needs it. Absolutely. Will units be available to H-2A or H-2B visa non-immigrant residents? And are there elevators to access the third floor? So third floor, yes, we have elevator access throughout the entire building. And I'm not sure about what the visa, I don't really know what that is actually. Are people asking if, like, US citizens only will be, oh, farm and temporary workers. Well, I mean, it's really intended for people, this is permanent housing. So people who live in the community will probably move in and not want to leave. I don't see that there would be many opportunities for people who are, you know, transitory or who aren't planning to be around for a long period of time. That's not what this is for. Will seniors have a separate floor? No, I don't think so. We are really going to be giving people the apartments as they become available. So if you're first on the list, you get to choose first which apartment you want, you know? So, I mean, it really depends on where you are in the waiting list and what's available at that time. Yes, all the apartments will be integrated. That is actually the purpose of supportive housing. And the reason that we have to build our building this way is so that we have people integrated into the community. So our focus is mental health. So historically, our agency has been around for 40 years working with people with mental health concerns. And our agency was started when they started closing all the institutions like 40 years ago. You know, they closed all the state hospitals and people needed a place to live. And they realized that plenty of people who'd been kind of locked away were perfectly capable of living in the community. And the regulations around this are to ensure that we're not putting those people over there and, regular folks over here. Everyone's regular. We're all kind of on a spectrum of mental health on any given day. So yeah, the point of this is to integrate people into the community. And I think that you probably live next door to people who have mental health concerns right now, whether you know it or not. Friends, family, neighbors, coworkers who would maybe qualify for our apartments, and you might not know it. Is storage available for residents? Yes, there is storage available. I believe there is a sizable storage closet in each apartment. I can have Laura nod yes or no. Our architect is here. Yes. I don't know if we still have common area storage. Do we for this building? No, we don't have common area storage, but we do have a bike room. So if there's, we have a mail room, but we don't have a lot of extra storage outside of the apartments. Will children be allowed to live there? Yes, children will be allowed to live there, but in our experience, most of these apartments are going to be single bedroom apartments. We have 42 one-bedroom apartments planned and 18 two-bedroom apartments. So there may be children, but the apartments aren't going to be large, and we don't intend for this to be, it probably isn't going to have a lot of kids. That's just not our experience with this kind of building.
Anyone have any other questions? These are all great questions.
Yeah. Will we need to purchase a new ladder truck? So I believe the answer is no. We met last night with the fire department and we showed them the building. We showed them, the floor plans and the elevations and the engineering specs. And we came up with some solutions to make sure that they could reach everywhere in the building that they needed to reach. The requirements for this building, because it's being funded by some state funding, in terms of fire safety, they're very strict. So there are firewalls and fully sprinkler systemed and fire doors and areas of refuge and all of these things. So it's very safe. And so I believe that what we decided last night, Laura, was that the walls were rated in a certain way that would give ample time for a ladder truck from whatever community nearby to get there if it was needed. Where is there similar housing comparable to what is proposed? So there is a brand new complex like this being opened in Hudson. It's in Hudson Falls. It's either Glens Falls or Hudson Falls soon. It's smaller than ours. It's smaller than the one we're proposing, but it's the same model, the same integrated supportive housing model. There are also some like this. There's one in Schenectady. There's one in Hudson, New York. There are a bunch nearby. There are a few being planned for the Troy area. There are several in Albany. But this is the first one in Saratoga County. Actually, the one in Ballston Spa that we're building currently will be the first one in Saratoga County, but this will be the second. But there are a lot of examples of this throughout the state. Who's funding the project? So the operational funding comes from the Office of Mental Health, and that allows us to staff the building as richly as it is staffed. And the capital funding is coming from the state through HCR, which is Homes and Community Renewal. and they invest a lot of money in community development, community revitalization, and affordable housing. Oh, we also will be getting potentially a grant that we're working on right now, right, Sue, from the Federal Home Loan Bank.
Hopefully.
Right. When is the planning board meeting? So the next planning board meeting that we are attending, I believe, at the 25th of this month. It's the 25th of this month at 6 o'clock, I believe. And plantings of new trees, a part of the plan. I would love there to be plantings of new trees. We love it to look beautiful, you know, and be green. And so, yes. You're very welcome. Elms, please. Okay. Thanks.
Good job.
Yeah, nice job, Sybil. Any other questions for Sybil? This was great. And again, you have her contact information. If you want to give her an email or have any other questions, we'll let you all know. Go ahead, Sybil. What?
I'm just going to share my contact information for one more second. Let me know.
Oh, excellent. Great.
If anyone missed it, please feel free to reach out to me. I'm happy to answer any questions or talk to you about anything concerning the building.
Yep. And we will post the presentation, and we're also going to post the recording for people who couldn't make it, just so that anybody can watch it if they'd like. And I'll let you know when that's available. We'll give you a holler. All right. And I want to thank everybody for coming. We appreciate your support and in your, looking into the town and village and being, active in the community. And we think it's great. And I want to thank everyone for coming tonight.